Hey, I'm your host, Dr. Desiree Cassell. I'm an orthopedic and pelvic floor physical therapist specializing in women's health, aka pelvic floor. I'm a wife, mom of 3, foodie, lover of all things movement and nature, and I'm super passionate about educating, empowering, and supporting other women like you to find and maintain balance throughout all aspects of their lives, without pain, pressure, or peeing their pants. And this is the Balanced Momtality Podcast, where we will talk about all things pelvic floor, your core, and optimizing your pregnancy, birth, and postpartum recovery, providing you with the knowledge and tools so that you can feel like the strong, playful, and happy mom that you and your family deserve. Now let's get you out of those pads and back to loving movement. Fill up your water, pop in those AirPods, roll out your mat, and let's connect. Before we start today's episode, just a quick disclaimer that anything mentioned in this podcast is not meant to treat or diagnose any medical conditions. If you have any questions or concerns about your healthcare needs, please seek the care of your medical provider. This is also a safe space where we will be talking about very sensitive but important topics, such as issues with peeing and pooping, relationships, and even sex. So if you have littles around, probably a good idea to pop those AirPods in. But otherwise, I hope you enjoyed today's episode. Hey friend, happy to have you back for another episode. We just got done chatting about urgency and that really uncomfortable need to go to the bathroom even if you just went. So if you have been suffering from urge incontinence, which is leaking on the way to the bathroom, or urinary urgency where you are just getting an intense urge to go, and maybe you just went, maybe you go and it's a little bit and it's just not making sense, definitely go check that episode out. It is going to be super helpful in making sure that that urgency doesn't start to take over your life, because it can, and it can be so frustrating. So we're just going to stop that and go check out that episode. But today we are jumping back into our Restore the Joint series, and we are talking hips today, baby. And I love the hips. This is a space in the body that gets so much awareness, right, of pain and discomfort, maybe tightness, maybe you don't know if it's hip pain, but it is crucial to make sure the hips are functioning well, especially for pelvic floor function. So if you're somebody who has felt like they've had tight hips, or maybe you've just had a pain in the butt that won't go away, literally, right? Maybe you've used a lacrosse ball, you've massaged it, you've stretched it, you've strengthened your glutes, and that pain deep in your butt is still there, then this episode is going to be super helpful for you. But maybe you don't even have what you would think would be hip pain, right? Maybe you don't have tightness. Maybe you don't feel weak or unstable. Maybe you don't have any pinching in your hips. Maybe you don't have that butt pain, but maybe you have low back pain. Maybe you have tailbone pain. Maybe you're leaking with your exercises. Maybe sex hurts. Maybe you have plantar fasciitis. Maybe your knees hurt, right? So all of these symptoms that we've talked about throughout the other episodes with the kinetic chain, especially down at the feet and knees, are really correlated to your hip function. If the hips are not stable and they can't hold that lower extremity in alignment and help absorb shock and forces, then they start to crumble. And the hips are the foundation for the pelvis, right? That pelvic floor sits at the base of the pelvic bowl. And the pelvic floor, while the foundation of the core, the hips are the foundation for the pelvis. They're what stabilize and hold that pelvis in a nice stable place in alignment. So just like we need our pelvis and our pelvic girdle and our pelvic floor to be a good solid foundation in order to have an optimal core, spine, head, neck, shoulders, right? We also need the hips to be really stable since they are the foundation for that pelvic piece. So we need to make sure that the hips have a good balance. It's the center of movement. And when the hips are tight, weak, or imbalanced, then the pelvis starts to compensate, the pelvic floor compensates, the feet compensate, and we can see issues both above and below. So again, don't discount this episode if you're like, yeah, my hips are good, right? Maybe you think they're good, and then you're going to go run through some of these assessments and exercises I'm going to mention today, and you might realize, my hips actually have some work to do, right? So we do tend to see a lot of that poor transfer of those forces when we don't have that solid kinetic chain. So I want to just emphasize here the importance of the foot and ankle restoration episode, because again, those are the true floor, right? That is where our body meets the floor and where a lot of our contact in our day-to-day life comes from. So that's where those forces tend to start. And if the feet are not happy, the hips are going to have to take too much of that load. So don't just start at the hips. We really do. There's a reason I started this series at the feet. We need to work our way from the floor up, making sure our feet and ankles are good, our knees are good, and now our hips. So some of the most common issues I see with hips, right? Because we can have all of the symptoms I mentioned above, but that doesn't necessarily mean you have a tight hip just because it feels tight. I know that sounds crazy. It might truly be tight, but maybe you have that pain in your butt, right? And you're like, oh, it just feels like I need to massage it and stretch it. So you're stretching, you're massaging, and it's just not going away. It might actually be that hip is unstable, meaning it's moving too much. And if you keep stretching it, you're just taking away the little bit of stability that the body is trying to create by locking up. So while it feels tight, and it probably is, stretching and releasing isn't always the answer. Sometimes it's bringing that stability and strength back into that joint so that the body feels safe enough to let go. So I just want to say that so that as you guys move through these assessments and exercises that we're going to chat about here in a minute, don't get too caught up on the pain. I want you to truly see what your body is telling you. Meaning, if you go into a mobility or stretch move, if it hurts, but you're moving way more than the other side, that side's not tight, right? Or maybe vice versa, it doesn't hurt, but you're like, oh man, this side is stuck. I cannot get into this stretch or this move very well on this side. Then that side is tight and it needs to be stretched out and released. But I want to just emphasize again, even if it's tight and truly does need some release work, a lot of times it's locking up and tightening because it's trying to stabilize. So the big goal that I'm always trying to achieve when we're working with the hips is stability. We need to make sure that that long pull, right? Our leg is like a pull, and it's balancing our pelvis and the rest of the body on the top of it. So if it cannot stabilize and hold, it is going to lock up. It's the body's way of protecting and making sure everything is being held together. So we really need to provide stability and control over one leg. This is a huge goal even before I get into stretching and releasing, because then we can get too caught up in that, right? Oh, I'm stretching, I'm releasing, it's still tight. And then we might miss the reason why it keeps locking up. So hip flexor tightness is definitely an issue. Obviously, in our culture, we sit way too much. So having that hip flexor coming from the middle of your back, yes, if you didn't know, your psoas, which is a hip flexor, attaches just below the rib cage in your mid back, and then it comes across the front to your femur. So this is why back breathing and back expansion and back mobility and core control is also crucial for the hips, because if your trunk and core are weak, your psoas is going to be trying to act like a spinal stabilizer way more than it should and not be able to help stabilize the hip like it should. So we need both pieces from below at the feet and knees and above at the core and spine and pelvic girdle to be balancing and holding this hip in a nice balanced space. Hip flexor tightness is also going to cause that lordotic anterior tilt, that lordotic curve in your back. You feel like you are constantly sticking your butt out and your back is arched, right? You probably have a tight psoas. So this isn't to say we don't want to stretch. We definitely do, especially if you're somebody who feels like you can't even get up very high in a bridge or a hip thrust or a lunge, right? Like maybe you're always feeling it in the front of your hips, and that's the muscles being tightened, right? And it's a brick wall stopping you from getting any higher. And that over time, especially as we age and sit, and if you have a desk job, does get tighter and harder to then fully extend the hip, which causes the back to arch. So we need to make sure that we're keeping that open, but we also don't want to put too much emphasis on that hip flexor. It can also be that lack of stability coming from glute underactivation, right? Our glutes are shut off. That tilt, it's this vicious cycle. If you visualize the tilt, right, that curve in your back, your butt sticking out, and that anterior tilt, that actually lengthens the glutes. So while your hip flexor is super tight, your glutes are kind of actually in a little stretched out position, making it harder for them to turn on. So this can cause piriformis tension, piriformis syndrome, that tight, annoying pain in the middle of your butt cheek, because it's trying to do the work that the glutes and pelvic floor are trying to do. But the hips and core are part of the same system. They're not separate silos. So we need to make sure we are addressing that, because anatomically, we do have the obturator internus is an internal pelvic floor muscle, but it comes out and attaches the hip and acts also as a hip stabilizer and external rotator. So it's a deep glute muscle. They're deep external rotators. And being that that muscle goes into the pelvic floor, this is usually where people come to me and they finally see relief, because they didn't get the internal release work and internal coordination work that they needed. They saw a orthopedic physical therapist, which I am also, but that person might not have addressed internal pelvic floor, right? They might have done the piriformis figure 4 stretching. Maybe they did some clamshells and some bridges. They did some hip flexor stretching. It's just not getting better. Like, it got a little better, but it's still there. Then they come see me, I go internal, touch that muscle, and they go, oh gosh, yep, that's radiating right out into my butt cheek where I have pain. I'm like, we found it. Then we can work it out and work on stabilizing it so it doesn't have to lock up so much. So we do need to make sure we're thinking about this whole big picture, and thinking also about bringing the breath into the hips. So there's these positions that I like to call hip breathers, and hip breathers are just movements like a stretching yoga mobility pose that not only mobilizes the hip, but we're also emphasizing the breath getting into the hip. And again, because that hip connects into the pelvis, and because that obturator internus is coming internally and externally, you can bring that breath deep into the pelvic bowl, and it will contact that obturator internus muscle, therefore helping release the hip, relaxing the hip tension, and opening up the whole pelvic girdle space, not just pelvic floor. This really helps get into those tight hips. So I love hip breathers. We're going to talk about those here in a minute. And those are more the exercises and mobility moves that you do want to be doing on the regular to make sure your hips are staying nice and mobile and activated and stable. So the first thing we want to do is just bring awareness, right, into your day-to-day to see, how are my hips functioning? So I want you guys to assess yourself, whether it's today or sometime this week or the next time you're working out, or maybe you just notice one of these symptoms the next time you do these things. I want you to remember, ooh, yeah, that's not a good sign. We've got some work to do on our hips, okay? So the first thing you want to start to check in on is, can you rotate your hips without tension? So can you go from external rotation to internal rotation? Can you sit in crisscross applesauce? But can you also switch where we sit in side sitting 90-90, where one leg is in external and one leg is in internal? This is also called deer pose in yoga. And if you feel a side that's a lot more stiff, then there you go. You have some issues with that range of motion. You should be able to go from that side sitting 90-90 position to the other side without your hands. So that's not only your range of motion ability, but your control and stability in your hips as you rotate like a windshield wiper side to side. So that's another fun little move to try. But also start assessing, do you clench your glutes? Are you standing there just holding your butt super tight? Maybe you're also just posturing, hanging into your hips. This is a terrible posture and tension squeezing habit that a lot of pregnant and postpartum moms do, and even non-moms do this. But I especially see this postpartum because the glutes have been shut off from being stretched out, and to compensate, we hang into the hips or the glutes just clench to try and provide that stability because they're feeling weak. Unfortunately, this increases the pressure in the pelvic floor, increases tailbone tightness, hip tightness, urgency, pelvic pain. We don't want any of that. So just start assessing, are you clenching your glutes? If so, breathe into them, shake them out, and just have that check-in throughout the day. Make sure you're not clenching. The other thing to check in is, does your low back hurt when you're doing like squats, deadlifts, glute bridges? This is another way to show your body and yourself that your coordination and motor planning is not moving through the system like we want it to. Because when we're doing those moves correctly, then we are not feeling that in our back. So when we are feeling it in our back, it means that our glutes aren't doing what we want them to do, and it means our core is not doing what we want it to do. Because when we move through these movements, your core, that TA, your pelvic floor, diaphragm, multifidi, all these muscles should be holding your pelvic girdle and rib cage in that stacked neutral alignment. And then as you move through a deadlift or a squat or a bridge, you shouldn't feel that movement come into your back at all. So if it does, your core was unable to hold it, and or your hips were unable to get you there. Maybe your hip flexors are too tight and it's making your back do the work. Maybe your glutes are just underactivating and not turning on, making your back do the work. Or maybe it is just so tight, your back is taking the movement. So we do want to look and make sure that you are feeling the move where you should. And you should not feel bridges, squats, deadlift in your low back. Obviously with deadlift, we're getting some back engagement. So back engagement, right? The feeling of muscles turning on is different than feeling pain or overactivity. Like if you only feel your deadlifts in your back, we are doing it wrong. We should mostly be feeling it in our glutes and hamstrings. So we just want to make sure that our motor planning is correct. Observe your daily movements. How do you get up and out of a chair? How do you climb stairs? Do you always favor starting with one leg over the other? Or can you actually go upstairs one over the other, right? Like we should. And again, we want to make sure that we are not just thinking tight hip flexors. I know hip flexors can be tight, but they really get a bad rap and we are overstretching because sometimes, again, it might be tight, but the true way to unlock that tightness is through strengthening that muscle so it feels safe enough to let go. Your psoas is a muscle that really is integrated into our autonomic nervous system, meaning it holds more of that emotion and stress and trauma. And if your body and your nervous system are feeling tight and stressed and worried, they're not going to let go. So we need to make sure it's feeling soft and strong and able to let go so that when you stretch, it actually releases. And so with that, I want you to make sure that we're not only assessing our movements, but we're starting to optimize and restore this space as well, whether you feel like you have hip issues or not. And so again, I want you to first start with introducing the breath work, and that is going to be added in to the mobility moves that I'm going to mention here in a minute, those hip breathers, right? So they're mobility moves, but we're bringing that breath deep into the hip and thinking about bringing the breath wherever it feels tight. and we're getting that space nice and mobilized, then we're going to activate it and get those muscles strong and stable, and then integrate it into functional movements. So the simple tips that I have for the mobility moves are the hip 90-90. So this is that side sitting 90-90 position. One leg is in internal rotation, one leg is in external rotation. The other move that I think is super helpful is a deep squat. You want to be able to have the flexion movement in that hip to get into a deep squat. If your hips feel tight in a deep squat, add a yoga block or a little stool, but those are super helpful. You can also try Happy Baby. That also gets the hips and knees nice and deep and wide. Another one that's really good is a pigeon pose or a figure 4. Pigeon pose is a little different than figure 4, but we're thinking about this move, especially in the figure 4, we're really getting into the piriformis. This is stretching that deep hip rotator. However, it is not stretching the obturator and internus. So that one is one that we need to actually stretch through that internal rotation moment. This one can be a little trickier to get into, but pigeon pose and figure 4 people know a little bit more easily, and it's easy to look up. So it's a great place to start, but just know if that's not reaching it exactly, get on a coaching call, because I have a few other poses that I don't want to describe on here that can get a little complicated, but will help you get into that obturator internus. And so we're thinking about these mobility moves in the hips, right? 90-90, deep squat, figure 4. I also think a lunge hip flexor stretch is fabulous, where we are making sure that trunk is not being pulled into an anterior tilt. So we're making sure that your core is in neutral and you are actually going to squeeze the glute on the side that you're stretching. This is the only time I say clench that glute, squeeze it, because it's going to prevent the pelvis from falling into that anterior tilt. And this is when people go, oh, I finally feel that hip flexor stretch now. Whereas before in that lunge position, they didn't. So if you don't feel it in the lunge position, make sure you're squeezing your butt on that side to tuck the glutes. Then you can also lean in and lunge across your body to make sure we're getting that full stretch up through the trunk, not just at the hip space. But then how do we want to engage and stabilize these muscles? Because we've mobilized them, we're breathing into them. Now, how do we turn on the muscles around them? So one of my favorite ways to get the glutes turning on are bridges. And if you're not feeling bridges in your glutes, we also need to get you on a coaching call and figure out why. One of the first tips, is bringing your heels closer to your butt, especially if you're only feeling it in your hamstrings. And also think and squeeze glutes. Make sure your glutes are the movers in your bridge. They're really going to get things activated. And if bridges are easy, single leg bridges are even better, because now we're adding that stability and control in the hip. Whereas the other bridge with both legs is a little bit more for activation. And we are making sure it's not coming into our back. So we're not just bridging up as high as we can. If that movement comes into the back, we've gone too far. And then remember, if you feel tightness on the front of your hip when you do a bridge, we do have some hip flexor tension and maybe tightness that we do need to work out. But the bridge is a great one, and or single leg bridge. Another thing I love for the hips right now is just standing on one foot. Standing on one foot is amazing. We're again engaging. We're connecting that whole kinetic chain. Down at the feet, we're engaging the tripod. We're aligning the knee. We're engaging the glute, not clenching the glute. We're just turning it on, right? There is a difference. We don't just want to clench it as hard as we can. We're engaging it. You're going to engage your core, and then you're going to feel nice and stacked on that one foot. But even better, start playing around with what we call airplanes. This is standing on one foot, but then you're going to try and open like a book towards the wall. So you're kind of opening and hinging over that leg. I am going to try and make a post about that video or that exercise specifically on my Instagram at The Balanced Momtality. So go check that out, because that exercise is kind of hard to explain, but amazing. You can also look up airplanes. Right now, I'm obsessed with a combo move that's an airplane deadlift. I know it sounds kind of crazy, but it's amazing. And it really helps to stabilize and unlock the hips. One of my favorite things to do. And then again, we also want to think about the lateral glutes. These are parts of the glutes and hip stabilizers that really get forgotten about. These are the lateral muscles, and we don't live in that lateral plane, right? We run, we walk, everything is front and back, not side to side. So those muscles can get pretty weak, and this can be a big reason why that piriformis locks up, because it's not getting the help it needs. So this is strengthening the glute medius. So things like sideline leg raises, crab walks, and again, even standing on one leg. Side planks are another great one. I mentioned these exercises in the knee episode because, again, we need that hip stability and control to align the knee and make sure that that knee is in alignment, aiming straight ahead. Clamshells are one that can be good, but also can cause issues. So I want to caution you with clamshells. They used to be one I gave to a lot of people. After doing internal pelvic floor, though, I can tell you I actually don't give them very often, because I find that, yes, that piriformis might need to be stronger, but a lot of times it's trying to get everything around it stronger, and then that pain goes away. So there are instances where I give clamshells for sure, and go ahead and try them. If they don't make pain worse, go for it. But if you try them and they're crampy and they're making the pain worse, then don't do clamshells. In fact, you might even want to try a reverse clamshell. You can look that one up if you want. We're not going to dive into that one today. But overall, we also don't want to forget hip flexor strengthening. This is the part that people usually miss, right? We're stretching, and rubbing the hip flexors and thinking only glute strength. And this can get us in trouble. We need our hip flexors to be strong. So I also want you guys to think about strengthening those hip flexors, whether it's through a single leg raise, lying down on your back, or putting a band above your knees and marching in place. Engage your core. Exhale as you slowly lift a leg up, and just use that band for resistance and start getting those hip flexors stronger. You can play around with the band above the knee or on your feet, either way. But this is exactly what we do inside of my 12-week on-demand restore program. We are going through the whole body. We're restoring the core, the pelvic floor, the hips, the knees, the upper body, and it is all in one place, as well as my hands-on manual tools to help you get the added benefit of the release work and hands-on work that you might not get since you're not coming in person. But I am here if you are local and want to come in person and get that hands-on work. Totally here for it. Or virtually through a coaching call, I can still look at those patterns, see your individual issues, and give you a more structured, individualized plan if the on-demand system just isn't quite your deal. Also, right now, guys, super exciting, my Pelvic Floor 101 Root to Rise Masterclass is free and open to you. I'm putting the link in the show notes below, so make sure to check it out because it is a free resource for you to start learning the basics of what we're talking about in this show, and so that you can know what is normal, what's not, how can I tell what to just deal with and what I can get help with. And it comes with a 5-minute breath work exercise that you just have to hit start on, and I walk you through it, friend. So make sure you click that link in the show notes below and go check out that free Pelvic Floor 101 Masterclass now. Otherwise, stay tuned for the rest of the Restore Your Joints series, and we've got more good stuff, pelvic floor, core, and more coming your way. Well, that's it for today's episode. I hope you enjoyed it as much as I did, and I want to thank you so much for taking the time out of your busy day. I know you've got so many other important things going on, but I hope it was helpful and you leave here with some tools to help you in your healing journey. And I just want to ask you, if you have found this helpful, to please leave a review on iTunes. Scroll down to the bottom of my podcast page and leave that 5-star review so it can help other women see this information. And also, if you want to be a part of my community of amazing women trying to balance all the things, great tips and insight and sharing stories and just motivating each other along the way, feel free to join my Facebook group, The Balanced Momtality, Wellness and Support. I hope to see you here next time on the Balanced Momtality Podcast.